May starts Stroke Awareness Month, and we wanted to get ahead of the game this afternoon and learn all about what we should be looking out for. And Dr. Eugene Lin with Mercy Health joins us now. Yeah, what are the signs of strokes? I know, trouble speaking, maybe numbness in the arm, but this is a wide-ranging thing.
Absolutely. So for us, it's very important. So the most important individuals are the patients and the community members themselves, and making sure that we recognize strokes, because they're the first line that we have to make sure that patients are recognized having the strokes and then getting them to the hospital so that we can start having the treatment. So we usually like to, during Stroke Awareness Month and every time we see our patients and talk to the family members, remind them what to look for. And so the acronym BFAST has been what we've used to sort of teach everyone to remember those 5 signs and symptoms. So for us, B is for balance, having them walk, seeing if they can walk well. Are they going to walk in one direction or wobble a little bit? E is for eyes, making sure that their vision is good. Do they have a vision loss in one eye, affecting both eyes? How well are they seeing? Can they move their eyes all the way to the left and the right? F is for face, making sure that if they have a facial droop, when they smile, is it equal on both sides? And then continuing on, arms, very simple, holding up the arms. If one side drifts or they can't even lift that arm up, that's one of the easiest signs to see that they have a stroke until proven otherwise. Speech is just hearing them talk. Can they understand, follow commands? Can they enunciate? Can they speak clearly? And of course, time, just making sure you call 911, making sure EMS comes, evaluates, and takes them to the nearest stroke hospital.
People being the way they are, at least men, you're stubborn, and so maybe you're not even aware.
Absolutely.
But usually it's probably the people around you are the ones that would notice, Dad's not right. We need to call 911, or Dad, are you okay? Could you do a little bit of this? So yeah, it's a matter of being observant and feeling the signs and proacting.
Yep, and so that's why we always encourage, when patients fall, they have their family members nearby. We use that time to sort of recognize, because patients, when they see us, they get better from the stroke. They always ask, what can we do to make sure we don't miss another stroke? What can we do, now that a family member has one, making sure that we prevent the next one, making sure that they don't have another one.
This is probably more likely to happen when you're older. But what's like the earliest you see a stroke occasionally?
It can even happen in kids, pediatrics, just depending on the cause. So it's very important that to recognize that even young people can have strokes. So making sure that it's on your mind when you have the symptoms, no matter the age, to make sure that they get the treatment in the right frame of time.
Hypertension, hyperlipidemia, diabetes, obesity, smoking, atrial fibrillation, prior stroke. Those are risks. They raise the risk of it happening.
Absolutely, and those are also preventable. Those are treatable. Those are the ones where you want to know that you have them, see your doctor, have those follow-ups, making sure you're on the right medications, because we can modify them. So that's why we like to emphasize that as part of the education that we have for our patients, for their family members, making sure that, making sure they don't get another stroke by treating your diabetes, making sure they're on the medication to lower their sugar levels. If they have high blood pressure, lowering the blood pressure less than 130 optimally, being on aspirin. If they have atrial fibrillation, being on the right blood thinner, anticoagulation, and going from there.
And the thing is, if you take good care of your body, your body will take good care of you. There's kind of a payback there, so diet, exercise, a lot of factors you must encourage with that.
Absolutely. So for us, that's why it's really important. We encourage patients to have those conversations with their physicians, have their family members talk to their loved ones so that they're getting their risks treated.
Dr. Lin, thank you so much for coming in today. Appreciate it.